Depending on what part of the world you are in, some health authorities will fund that, particularly if the patient is of a younger age group, they've not started their families, or other factors will be taken into account. Some health authorities will pay for you to be able to store your sperm cells if you've been diagnosed with cancer and you're needing chemotherapy. Or if you are on the other end of the spectrum, you've already got children, but you want to have more children. Often you will be required to fund this procedure yourself. Opioid medications. In this class of drug, we have morphine, oxycodone, fentanyl, several of these highly dependent and highly addictive painkillers. The long-term use of these opioid medication affect the Leydig cells. And these are the cells that are found in the testicles that are responsible for the production of the testosterone hormone. This then goes on to impair sperm cell production, leading to low sperm count. But in addition to causing low sperm count, continuous and long-term use of opioid medication leads to impaired sexual function in men, otherwise known as erectile dysfunction. Testosterone replacement therapy. Now, one thing that you have to know about testosterone replacement therapy, although it's a very useful drug when it's given to men who have a significantly low level of testosterone and they are finding themselves with erectile dysfunction, it does impact your fertility. Before I talk about how it affects fertility, let me highlight that it's not a bad idea to have testosterone replacement therapy if your testosterone level is low, particularly if you are finding that you are always needing drugs like Viagra or tadalafils, which are medications that are important and help men to have an erection when their sexual function is impaired. But what the drugs of this class do is that they suppress the body's own ability to produce testosterone by itself. And it does that because it disrupts the body's normal hormonal feedback loop. And remember, this feedback loop is absolutely crucial for the body to produce its own testosterone, which will lead to the production of sperm cells. So I've come across a lot of patients, particularly in their late 20s, in their 30s, who felt like they were doing the right thing by receiving testosterone injections with a few months interval. But like all the other drugs that I've described, testosterone replacement therapy can lead to a low sperm count. And at the extreme end of things, your testicles stop producing any form of sperm cells. And that condition is known as azoospermia. Sulfasalazines. This drug is usually used in inflammatory conditions like Crohn's or rheumatoid arthritis. But what many do not know about this drug is that it lowers the sperm count, in addition to significantly affecting the motility of any sperm cells that are produced. Thankfully, though, the effect of sulfasalazines are reversible once the drug is stopped. Another drug that affects fertility in much the same way as the sulfasalazines are the calcium channel blockers. These drugs are used to manage high blood pressure and at times a condition known as Raynaud syndrome. Examples of drugs in this class include nifedipine, amlodipine, and verapamil. The drug that most men are shocked can lead to infertility are the alpha reductase inhibitors. In men of the older age group, they are used to reduce the size of the prostate resulting from a condition known as benign prostatic hypertrophy.